Welcome, my name is Mary Wekesa. Patients requiring life-saving procedures in both private facilities and some public hospitals are facing uncertainty due to confusion surrounding their transition to the Social Health Insurance Fund, that is Nhif. Reports indicate that private facilities remain wary of Nhif reimbursements, leading many to demand cash payments for dialysis during the transition period. Several patients across the country reported being forced to pay out of pocket, citing unanswered questions about Nhif.
Nimekuwa na shida ya kidney for the last 3 years. Nimekuwa nikidialyze mara 2 kwa kila wiki. Lakini sasa wakati wa hii transition from NHF to SHA tumepata shida. Jana nilikuwa ni dialyze. Kuja mahali nafanya dialysis nikaambiwa haiwezekani sababu hawajapata the way forward from the government.
However, Health Committee Chairperson Robert Pukose assured the National Assembly that no one would be denied services, claiming the transition has been seamless.
I want to assure Kenyans outside there and the honorable members in this house that no Kenyan will be denied the services. I think the unfortunate information outside there is that it is the ministry is not doing enough, but I know they are trying their best.
Medical facilities under faith-based organizations and the Rural and Urban Private Hospitals Association of Kenya, Rupha, have expressed concerns about the new Social Health Authority SHA contracts. The two umbrella bodies maintain that the government has remained non-committal on the payment of over 21 billion Kenyan shillings owed to them by the now-defunct National Health Insurance Fund, that is the NHIF. The facilities have subsequently refused to sign the new contracts, highlighting that the binding agreements are designed to lock them out of service delivery and disenfranchise Kenyans seeking healthcare services. The medical facilities have similarly taken issue with the government's failure to assure them that monies owed by the defunct NHIF will be paid under the new system, expressing fear that records of what is owed may be destroyed or lost in the transition.
The reason we worry about a transition with claims pending is because also there is a system change. And we've had experience in the past when where a system changes and some of the claims that were on process kind of become lost in the system. And it takes time before you can have them reconstructed, audited, verified. We've been following up, individual hospitals collectively as FBOs, and we've been following up, individual hospitals collectively as FBOs, and as of now, we feel there has been, it's in the about 6 billion that is still not cleared.
NHIF owes healthcare providers, government, faith-based and private, total about 30 billion. For us in the private sector, what we are owed is somewhere around 15 billion. We have been categorical that there should have been a reconciliation of pending bills so that each and every hospital can sign off with NHIF before NHIF closes. What we are concerned as providers is that somebody could switch off a switch one day and those claims become lost.
The stakeholders maintain that even though they engaged the government in the policy formulation stage, where they gave recommendations and voiced reservations regarding the contentious issues, the authority disregarded their opinions. According to Mwenda, the referral system is a deliberate attempt to cripple their operations.
Hospitals have been providing outpatient services through capitation for populations that chose these hospitals. The new arrangement, outpatient services will be provided in primary health care facilities, level 2 and 3, which means not at hospitals. Hospitals will only receive referrals from that level, and they'll be paid a fee for service. The other challenge is, of course, the system is not proper operational for us to do verification.
Is saying that that level 5 hospital cannot provide direct outpatient care to those 24,000 Kenyans who have been using that hospital. Kenyans might not know this, but if you walk to that hospital, it is illegal for that hospital to provide you care.
The two umbrella bodies, which constitute a sizable portion of healthcare service providers in the country, say they will now treat patients on a cash basis as there is currently no contract in place. They also accuse the government of mischief in crafting the SHA contracts, terming the reduced benefits package a slap in the face for many Kenyans who, despite the increased contributions, will be forced to make out-of-pocket payments. The union insists that members will not sign the contracts until SHA amends the offending clauses. As the government and key players in the sector engage in a battle of wills, the delivery of healthcare services has been disrupted by the standoff, with opinion divided on whether the transition was rushed or adequate preparations were made. The Kenya Medical Practitioners, Pharmacists and Dentists Union KMPDU Secretary General Dr. Davji Atela has condemned the Tuesday rollout of the Social Health Insurance Fund Nhif. Dr. Atela tore into the new National Medical Insurance Scheme, labeling it as a sinking ship that will deny Kenyans access to critical healthcare services.
It's not possible to actually rush to roll these things, because, I mean, this is the first time UHC is being launched, or these things are being rolled out, or policies are being rolled out in the country. But they don't look at the aspect of service delivery to the people.